Good evening, everyone. Welcome to our Lab CAA assessment for Module 3, Week 2. And today we will be focusing on syndromes that classified according to Zang Fu organs theory. So to start the ball rolling, let's ask Ma'am Lynn to take care of the first 10 questions. Ma'am Lynn, good evening.
Good evening, Dr. Hector. Good evening, everyone. Okay, question number 1. Consumption of fluid in the large intestine frequently causes all the following except dry stools, dryness in the mouth, constipation, dryness of the throat. Lahat po to, consumption of fluid. So my answer is letter E, voracious appetite.
Okay, all the four would be caused by consumption of fluid in the large intestine. So what causes the voracious appetite?
What causes voracious appetite? Ano nga ba?
Voracious. Kain ng kain.
Kain ng kain. Parang yung may craving lagi.
Yes.
Yung
Can I help Ma'am Lynn?
Sige po.
It is due to stomach fire.
Yeah, okay, very good. Thank you. This is very common.
Tulong-tulungan na po tayo, Ma'am Lynn.
Okay, number 2.
Okay. Number 2. A patient has the following signs and symptoms. Poor appetite, abdominal distension for 3 months, lassitude and aversion to speaking. The tongue is pale with a thin white coating and the pulse is slow and weak.
So
This
let's go to the correct answer.
Belongs to a deficiency of spleen qi.
Okay, what sign and symptom would clinch the diagnosis?
Signs and symptoms. Itong ano po, poor appetite, lassitude, aversion to speaking, poor appetite, abdominal distension, and lassitude. Mga spleen issues po eh.
What about lung qi deficiency?
Pag lung qi deficiency, merong shortness of breath.
What about heart qi deficiency?
Pag heart qi, there should be palpitation.
Kidney qi deficiency?
Wait lang. Heart qi deficiency.
Yeah, palpitations.
Yeah.
Correct na yun.
And also, on exertion, magkakaroon ng chest
pains or parang tightness sa chest.
Tightness of the chest. Okay, what about kidney qi deficiency?
Pag kidney qi deficiency, merong weakness sa knees, low back pain.
Which is not found in this patient, diba?
Yeah.
Okay. So with deficiency of spleen and kidney yang, what symptoms are we looking for?
Pagka yung coccidioria.
Okay, very good. Number 3.
Number 3. The patient has the following signs and symptoms: distension, fullness and pain in the epigastrium and abdomen, belching with a foul odor, and anorexia. The tongue has a thick and sticky coating and the pulse is rolling. This syndrome belongs to letter D, retention of food in the stomach. Kasi itong belching with foul odor, nang parang hindi natutunaw na pagkain nasa tiyan. Yun yung aking pinagbatayan bakit yung sagot ko po.
Okay. Yung iba alam natin except for, I think we've taken up deficiency of spleen qi, saka deficiency of spleen and kidney yang. So what about damp heat in the spleen and stomach?
Pag damp heat,
Ano ba nagko-cause nito? Is it caused by like eating too much sweets, cold, and
damp foods,
mga deep fried food?
oily, yeah, deep fried food. So mayroon to usually parang sticky na stool.
Do you think they will have this feeling of heaviness?
Distension.
With damp
Pwede
heat?
rin kasi damp heat po pero mas ang usually yung ganong pattern, ang distinct doon yung kanyang sticky stool yung dampness.
Okay, what happens as an invasion of spleen by cold damp? Is it safe to say that this is the opposite of the damp heat? Or
Invasion
almost the same, except that this is caused by too much cold? So
Mas
invasion of the
cold.
spleen, ibig sabihin hindi na dumaan sa dumiretso na kasi definitely this is very
Yung mga
kinain.
parang acute, yung mga kinain pa naranasan ko na to, Dok. Kumain ako ng mga parang fruit shake, biglang nag-grumble
Would you
yung
have
tiyan ko
diarrhea
habang nasa
here?
biyahe.
Will you have diarrhea siguro?
Oo. Parang di na ako mapakalinon sa sasakyan.
Mm-hmm. So
Muntik
with
na
the
magutom.
tension of food in the stomach, wala tayong nakikitang diarrhea, no?
Wala po. Mas
But diarrhea is supposed to be that spleen should be involved, right?
Yeah.
Number 4.
Okay. Number 4, a patient has the following signs and symptoms: fullness and distension in the hypogastrium and abdomen, loss of appetite, sticky saliva, heaviness of the head and body, and loose stools. The tongue has a sticky white coating and the pulse is soft. This syndrome belongs to fullness, distension. Letter, Letter C, invasion of spleen by cold damp.
So here we can actually see, pag sinabi mong damp, meron na pong heaviness. Heaviness of the head and body.
Tsaka sticky white coating.
And the saliva,
So,
sticky saliva.
Sticky saliva.
Sticky white coating of the tongue and also soft pulse, no? Okay.
Saka loose stool siya, Doc. So, indicative ng cold. Kasi kung heat po yan, din yan, parang mas dry. Tapos merong yan, burning sensation.
Yeah. What I like about the questions, parang tuloy-tuloy siya, di ba? May connection lahat.
Yeah.
Number 5 po.
Number 5, dysfunction of the spleen frequently causes all of the following, except foul belching and vomiting. Kasi abdominal pain, loose stools, bleeding, edema, mga related sa spleen. Yung foul belching, parang upward movement naman to.
So this is not the spleen.
Hindi siya spleen, siya. Mas to is retention of food in the stomach na nagre-resulta sa rebellious chi.
Yes. Very good. Number 6.
Number 6, deficiency of stomach yin can be differentiated by the presence of the following symptoms. Deficiency of stomach yin. Hunger with no desire to eat.
So, so the answer is A?
Letter A. Kasi di ba kanina yung stomach fire, yung voracious appetite.
Which comes first, stomach yin deficiency or stomach fire?
Stomach yin deficiency po.
Okay, eventually, magkakagana din siya. Para ang problem lang, parang hindi nabubusog, no? Stomach fire. And of course, merong thirst with a desire to drink cold.
Mag-binging yun pagka nagutom na talaga siya.
Precisely, yes. So, all of this, meron po sa stomach deficiency, di ba? Pero the thing that will differentiate it from other patterns, from other syndromes, is hunger.
Hunger with no desire to eat.
Yes. Number 7.
Number 7. A patient has the following signs and symptoms: burning sensation and pain in the epigastric region, sour regurgitation, empty and uncomfortable feeling in the stomach, easily hungry, thirst with a preference for cold drinks, and painful swelling of the gums. The tongue is red with a yellow coating and the pulse is rapid. This syndrome belongs to hyperactivity of fire in the stomach. Parang mga
Haba lang, no? Stomach fire na yan. Okay, can you tell us again what happens pag may retention of food in the stomach? Review lang po ito.
Ay, yun na yung may foul,
May belching. And with stomach deficiency?
Stomach deficiency, mayroong hunger but no desire to eat.
Okay. And also walang coating yung tongue, no?
Yeah.
Yung stomach. And what about damp heat in the spleen and stomach?
Damp heat in the spleen and stomach, nagkakaroon ng mucus, yung stools. Tapos may heaviness din, distension, may minsan may burning sensation pagka dumudumi.
And damp heat in the large intestine? Like, ano kaya ang
Parang din, halos similar din siya pala. Kung large intestine, merong din yun, parang burning sensation pagka nagdumudumi.
So anong
sticky ang
characteristic ng damp heat in the large intestine? Pag dumumi. Like, of course, we're talking about the stool here. So ito yung may amoy, di ba? Mucoid, then may mabaho siya.
Yung damp heat in the kanina, mas yung sticky na stool.
Okay, number 8.
Number 8, a female patient has the following signs and symptoms: pale complexion, lassitude, poor appetite, abdominal distension, excessive menstrual flow, and light red menses. The tongue is pale with a thin coating and the pulse is weak. This syndrome belongs to a deficiency of light red spleen. Hindi. Wait lang. Abdominal excessive menstrual dysfunction of spleen in controlling blood, kasi excessive menstrual flow.
And then the color is light red.
Light red. Yeah.
So it's a bit pale, no? Okay. What do you think would be the color, would be the problem pag heat in the blood?
Pag heat in the blood,
would you
shortened menstrual cycle siya, tapos dark red ang niya, menses.
Okay. Number 9.
Number 9, a patient has the following signs and symptoms: hypochondriac distension and pain, bitter taste in the mouth, poor appetite, nausea, vomiting, scanty yellow urine for 1 week. The tongue has a sticky yellow coating and the pulse is string taut and rapid. This syndrome belongs to damp heat in the liver and gallbladder. Kasi yung mga hypochondriac pain,
This is very liver, no?
Liver na talaga po yan siya agad. Tapos bitter taste pa. Tas scanty yellow urine, heat na po talaga din siya. Sticky yellow coating, indication ng damp heat.
Yes.
So,
Okay.
partner pa
Spring
naman.
thought pulse.
Parang wiry pulse.
Very
yung-
liver, a wiry pulse. Number
Okay.
10.
Number 10.
Mhm.
Deficiency of liver blood can be differentiated by the presence of the following. Numbness of the limbs and spasms of the tendons.
Okay. Easy. No?
Okay.
Okay, Ma'am Lynn, thank you very much. Si Ma'am
Okay.
Teresita naman. Ma'am Teresita, good evening.
Good evening po, Dr.
11
Hector.
to
Good
12.
evening, Ma'am Lynn.
Good evening, everyone.
Good evening, everyone. Number 11,
Mhm.
dysfunction of the liver frequently causes all of the following except letter E, chills, because hypochondriac pain, irritability, dizziness, and vertigo, spasm of the tendons are all causes of dysfunction of the liver.
Okay, you don't find chills there.
Opo, yes po, Doc.
Number
Mas
12.
lungs po. Ano.
Number 12, a patient has the following signs and symptoms: mental depression, irritability, and distilling pain in the costal and hypochondriac regions. This syndrome belongs to stagnation of liver qi.
Yeah, you will notice the depression there, no? Mental depression. So may kinalaman
Yes po.
po dito po yung lungs. So that means the lungs are too weak to actually control the liver, no? So if the liver is very affected, especially if you have this standing pain in the costal hypochondriac regions.
Liver na po talaga yung area na yun eh.
Yes.
Kasi normally the lungs will control the liver because is the grandmother of the liver. Yun
Yes.
po, diba?
Pag nag-stagnate kasi si liver chi, tumataas yung ano niya, yung kanyang energy, parang malakas siya. So instead of the lungs, the metal element controlling the liver, naiinsulto na po si lungs. Kaya for those who have depression, if you're a good practitioner, you will always want to look at the liver. And that does not happen if you go to a psychiatrist. So, kaya kailangan talaga tayo, makihalubilo, no? Probably we can help, right? So, the goal here is to actually facilitate the flow of the liver qi, no?
Yes po.
Patakuin talaga, no? So that eventually, para hindi na ma-depressed yung, kasi this is an example, classic example of the wood element insulting the metal element. Okay? So, yun.
Kasi hyperactive na po si liver.
Yes. Liver qi stagnation. Number 13 po.
Number 13, a patient has the following signs and symptoms: distending pain in the head, dizziness, vertigo, redness of the eyes, irritability, bitter taste and dryness of the mouth, yellow urine, and constipation. The tongue is red with a yellow coating, and the pulse is string taut and rapid. This syndrome belongs to letter C, flare-up of liver fire.
So here you can see that liver fire is very much different from liver qi stagnation, no?
Yes po, Doc.
So what differentiates it from liver qi stagnation?
Sa liver fire, Doc, there is dizziness and vertigo and redness of the eyes.
Bitter
And
taste.
then, yes, bitter taste. Yes po. And then the color of the urine is yellow, and there is constipation.
Okay. This is where looking at the tongue is very, very important, no? This is what will separate a not so good practitioner from a good one. Na nakita nyo? So, ang laki pa din tulong ng tongue. Diba?
Yes po, Doc. Very helpful talaga.
Kasi even if you have liver qi stagnation, the pulse would be string taut, wiry. Diba? And so, lahat ng liver issues, meron pong wiry po ang pulse. And of course, dito natin makikita na
So,
hindi
ma-distinguish lang po natin, Doc, sa mga symptoms
oo.
at sa tongue.
And you will be surprised. There are many cases who are like this. That's the reason why kahit anong gamot, bumababa nga yung BP pero tumataas ulit. Why?
Yes,
Because we're not able to resolve the issue.
The root cause
Yeah.
of the disease.
So let's spread the
Parang
word.
palliative na lang kasi yung gamot minsan.
Oo. 14.
Number 14, a patient has the following signs and symptoms: headache with a distending sensation in the head, dizziness and vertigo, tinnitus, flushed face and red eyes, and irritability, insomnia with dream-disturbed sleep, and soreness of the lower back. The tongue is red and the pulse is string taut, 3D, and rapid. This syndrome belongs to rising of liver yang.
So what makes this different from liver fire flare up?
There is insomnia, Doc, with dream disturbed sleep and soreness of the lower back. And then the tongue is red.
What
Liver
about
fire, tongue is
bitter
red pa
taste?
rin.
Do you find bitter taste in liver fire?
Ay, wala po, Doc.
In liver yang
The
rice?
rising of liver yang, wala pong bitter taste po, Doc.
Okay, can you tell us the progression? Like, of course, we all know that it all started with liver qi stagnation, diba?
Yes po, then liver yang.
Then naging liver yin deficiency. Kaya
Liver yang.
hindi niya makontrol si liver yang. So, magli-liver yang rising. So my question is, bakit affected ang lower back? And we all know that the lower back is always associated with a kidney issue. Pwede ba natin sabihin na affected na ang kidney rito?
Yes po, Doc. Kasi si kidney is the mother of the liver.
Okay, kasi nagkulang na yung yin ng liver, remember?
Opo, Doc.
So,
Saka na-nourish na liver.
the
So
liver,
magko-compensate po yung kidneys.
yeah. So the kidney
So,
being the mother will have to provide the liver yin. So magkakaroon the yin for the liver. In the
Yes,
process, the yin of the kidney will be
depleted.
depleted. So kaya magkakaroon na siya ng lower back issues.
Yeah.
Yun. And also, there is dream disturbed sleep. Yeah, connect lahat.
Connect lang.
Connected siya sa heart eh.
Yeah. There is dream disturbed sleep because the Shen is not being housed. This time, you're already affecting the heart, no? Because the liver, hindi po siya, like tumaas na po yung yang, ibig sabihin kulang na yung yin. When you say liver yin deficiency, meron na po yung blood deficiency, di ba? Kasi yin is generalized eh. It includes both blood, the fluids, and the
yes.
Yeah, whatever the fluids.
Parang malapit sa akin po, Dok.
Oo. So ang nangyari, the yin or blood is a very important ingredient that the heart should have for it to become the residence for the Shen. But in this case, wala na pong residence si Shen. So nagiging restless na po, nagiging dream disturbed na po ang sleep.
Disturbed na.
Yes. So ngayon, I have another question. We have tinnitus here. So how are you going to differentiate this? You also have tinnitus in kidney issues. How are you going to differentiate the tinnitus in liver yang rising from the tinnitus caused by kidney deficiency?
Tinnitus is one of the symptoms of kidney deficiency. So, by
Is there a
through nourishment,
difference? Will you have the same tinnitus?
yes,
Pitch
So-
Yeah,
sound, no?
pitch. Yeah. So which one has a high pitch?
Liver yung rising.
Liver yang rising, yes.
Ah.
So if it is kasi because of that, nag-deplete yung kidney yin. But there are cases na nauna yung kidney yin na deplete. So the tinnitus will be low pitched.
Opo. Now I know.
You actually know that already.
Nakalimutan lang po, Doc.
Okay, number 15 po.
Number 15. A patient has the following signs and symptoms: pallor, dizziness, tinnitus, blurred vision, numbness of the hands and feet, and scanty light red menses. The tongue is pale and the pulse is weak and steady. This syndrome belongs to none of the above po, Doc.
And what is
Kasi po,
supposed to be the answer?
kasi my answer is liver blood deficiency po, Doc.
Okay.
Because of the scanty light red menses. Blurred vision.
Numbness, no?
Opo.
If the answer is heart blood deficiency, what will you expect as symptoms? Of course-
There is always palpitations, Doc.
Okay. Will you have issues with memory?
Yes po, Doc. Ay, memory, di ba? Ay, memory.
Yes.
Oo, yes
Yes.
po. Tama.
Kaya yung mga kulang sa dugo, no, like heart blood deficient, they perform not so good at school. Do you think they will have sleep issues?
Yes po.
Yes. Kasi ano, 'di ba, pag heart blood deficient ka, walang
Mahirap makatulog.
mahirap makatulog.
Yung mga tossing and turning bago makatulog.
Ay, relate na relate po ako dyan. Paglampas na 10 o'clock ako, hindi pa makahiga na mahirap na ako matulog.
Until now?
Yes po, Doc. Kailangan
I remember your tongue
mahiga
was...
ako mga before 9, mahiga na ako, natuloy-tuloy po ang tulog ko. Pero
What's
kung
your-
after 10 na,
Was your tongue thin and pale and dry?
pale. Ay, hindi ko po natingnan, nakalimutan ko na po. Pale pa, Doc. And then,
Do you have...
little bit dry.
Kaya pala
Thin.
your, medyo madali ka makalimot din.
Yes po, Doc. Yun ang ano ko, concern. Ayun ang problema ko, Doc.
Okay.
Ngayon ko lang nabasa, tapos, nakalimutan na. Iwan.
Number 16.
Naiwan na sa ere.
16 po.
16. Dysfunction of the liver frequently causes all of the following except
Kidney. Is that the
fullness
liver?
of the chest.
You read it as liver? I read...
Dysfunction of the kidney pala, I'm sorry. Dysfunction of the kidney frequently causes all of the following except fullness of the chest, because soreness of the and weakness of the lumbar region and knee joints, tinnitus and deafness and edema, impotence and infertility are all causes of dysfunction of the kidney.
What about fullness of the chest?
Parang sa siya, Doc, sa lungs.
And the heart also.
And the heart. Lungs and the heart. All heart.
Upper burner, no? Upper burner.
Upper burner.
Number 17.
A patient has the following signs and symptoms: soreness and weakness of the lumbar region and knee joints, frequent clear urination, and dribbling urine after urination. The tongue is pale with a white coating, and the pulse is steady and weak. This syndrome belongs to deficiency of kidney Chi.
Yes, because if you have deficient kidney Chi, you cannot control, you cannot act on the bladder. No, the bladder is hindi ka na makapagpigil sa pag-ihi. That's why those with weak kidney Chi, or the worst, when you have kidney yang deficiency, kailangan nila lang mag-diaper. No? Yeah.
Buyag lang. Huwag sana mangyari.
No, kasi they cannot control their urination. They would not be able, because that is a sign that the kidney is not in control. It cannot control the blood.
Tama kasi kidneys and the urinary bladder are coupled region. Okay.
Yeah. And the bladder function depends on the kidney Chi.
Yes po.
So take a look at the, okay, when you look at the tongue, it's just pale.
Wala siyang
Yes po, parang walang ano pa.
Tapos, since may kidney Chi deficiency, mahina din yung blood, di ba? So, thready ang pulse. So, dito makikita talaga na pag thready, manipis siya, parang sinuli.
Deficient.
Yeah, deficient talaga. And weak, deficient. Number 18.
Damp heat in the bladder frequently causes all of the following except letter E, enuresis. Because enuresis is one of the symptoms of kidney yang deficiency, Doc.
Yes, or kidney Chi deficiency.
Oh, yes po.
Actually, when you talk about kidney Chi deficiency and kidney yang deficiency, you're actually talking about the same thing. The only difference is may cold limbs ang kidney yang deficiency.
Kidney yang po.
Pareho lang. Diba?
Opo.
So here, ang pinakaano talaga dito is the burning pain in the urethra. That's it. No?
May mga ano, Doc, UTI,
pati
no?
yung urine.
Yeah, at saka UTI. Yeah, actually UTI.
Oh, ito na po yung UTI sa medicine, Doc, no? Sa Western medicine.
Yeah. Yellow urine.
May amoy yung ihi.
May amoy yung ihi, mapanghi. Okay, number 19. So dapat yung ihi natin hindi mapanghi.
Opo. Number 19. A patient has the following signs and symptoms: fever, lower abdominal distension, frequent and urgent urination, burning pain in the urethra, and yellow urine. The tongue has a sticky yellow coating, and the pulse is rapid. This syndrome belongs to none of the above.
And what should have been
for me, this symptom belongs to damp heat in the bladder po, Doc.
Oh, you see?
Number 18.
Answer sa number 18.
Oh, then the others are takot pa maulit, di ba? Paulit-ulit. There is no such thing as ano eh. In fact, hindi mo ito makukuha lang isang basahan lang.
Opo.
At saka, it's always good to go back, no? What is 1 hour? Oh, di ba? Okay, number 20.
A patient has the following signs and symptoms: distension and pain of the costal, hypochondriac, and epigastric regions, belching, and acid regurgitation. This syndrome belongs to disharmony between the liver and the stomach. Because of the symptoms of hypochondriac and epigastric region. So, epigastric is sa stomach and hypochondriac is sa liver po.
As a result of a very dysfunctional liver, no?
Opo.
A very classic example is when you are always fighting in front of at dinner time.
Is this over-controlling cycle, Doc?
Yeah, kasi when you say harmony, syempre, when there is harmony, you're actually looking at the liver, controlling the stomach. But in this case, over-controlling na. So there's harmony. Diba?
Opo.
At saka dapat, ano lang ito hindi lang ang, kasi affected na yung stomach, yang na yang talaga yung liver. Can you follow? Yung liver kasi, diba, it's a yin channel. So, madali po siya maging yang.
Magiging yang. Yes po, Doc.
Nandun
Yun
na
ang
siya sa
explanation mo sa amin
pinakadulo na,
kagabi.
yes, na pinakadulo na ng yin. I hope everybody got that, no? Number 21. Ay, naku, paulit-ulit. Okay, thank you, Ma'am Teresita. Let's go to Ma'am Lynn
Thank you din
naman.
po, Dr.
Okay, number 21. Diarrhea at dawn is usually caused by yang deficiency of the kidney, of the spleen and kidney, letter
Okay,
E.
very classic.
Kanina na natin to, nadaanan na natin to.
Oo. May
Yeah.
review lang.
Review lang talaga, no?
Yeah.
You're not supposed to have diarrhea at dawn.
Yeah.
You can you can actually move your bowels at 5, between 5 and 7, but not diarrhea. So diarrhea is an indication that the spleen is quite weak, and the spleen actually depends on the kidney. Remember, because of the kidney yang, nagkakaroon ng power ang spleen to transform and transport. But the kidney is so deficient, okay? Especially between 3 and 5, no? 5 to 7 kasi yan yung pinaka-strong. So, kung mahina na dati, mayroon ka na kidney yang deficiency. So, at before 5 or even 4 a.m., nagkakaroon ka na ng diarrhea. Another name for this is cockscrow diarrhea.
Diarrhea.
Yeah, so very good. Yang deficiency of spleen and kidney. 22.
Number 22. Which of the following symptoms can be seen in either the cold syndrome of the excess type or the heat syndrome of the excess type? So letter D, abdominal distension and pain aggravated by pressure. Kasi kung excess, parehong aggravated by pressure, whether cold or heat yung cause.
Yes. So this is when you start palpating, like sinabi, saan yung pain? And then, of course, wag mong biglang ipapalpate na madiin. You go slowly. Kung may resistance or lumala yung pain or distension, when you apply pressure, then definitely we have an excess type, whether heat or cold. Okay. 23.
23. Deficiency of yin frequently causes all of the following except deficiency of yin, letter A, clear urine with increased volume. Kasi yung deficiency of yin, may yellow urine yun tas scanty. Kasi may heat na dito sa or kulang na yung fluid pag deficiency of yin. So scanty urine, tapos yellow. Kasi yung afternoon fever, insomnia with mental restlessness, night sweating, fever sensation, all yin deficiency, symptoms.
Usually the patient will ask you, why is it that I feel feverish when paghapon na, 3 p.m., 4 p.m. onwards yan. They feel parang may lagnat. Pero hindi naman talaga.
Hindi naman talagnat.
Mainit lang. So that is already telling us now most likely. Now you also understand why my favorite sensations of palms and soles. These are actually the yin side. Diba? The yin aspect, right? Number 24.
24. The patient has the following signs and symptoms. palpitation, cardiac retardation, and pain, and cyanosis of the lips and nails. This syndrome belongs to stagnation of heart blood. Kasi yung blood stagnation talaga po yung mga cyanosis na ano eh.
Oh, yes.
And nails. So dahil cardiac retardation and pain, so mas
Yeah.
heart talaga siya. May
And also,
palpitation pa.
yeah, if you notice, hindi nilagay yung pulse because most
Yeah.
likely the pulse would be irregular po ang rhythm. And,
Choppy pulse.
yes. And so you need to really refer the patient to us a cardiologist.
Yeah.
Malay nyo, yung cardiologist may issue rin. Okay. 25.
Number 25. According to TCM pathology, the pathogen that is frequently seen in late autumn is dryness.
Di ba falling leaves?
Bago mag-snow.
Autumn leaves
Tuyo.
pala. Autumn leaves, no?
Tuyo na muna siya. Tanggal na wala nang
Nahuhulog na sa mga ano. And cold, alam na natin yan, winter. Pag spring,
Winter, ang wind, spring.
ang dampness.
Di ba spring ang wind, Doc?
Yes.
Yes.
What
Then
about dampness and fire?
Dampness is autumn, and fire is summer.
Dryness is autumn.
Hindi,
Pero dampness is early autumn.
dampness.
Early
Early
autumn.
autumn. Fire is summer, okay.
Okay, 26. Hanggang 35 ha, Ma'am Lynn. Then 27 to ano. Okay.
Okay. Number 20. 26. Stagnant blood frequently causes all of the following except soft and movable nodules. Kasi hard tsaka fixed nodules yun pag blood stagnation. Lahat naman yung A to D, mga ano to, signs ng blood stagnation po.
Yes. So if you are able to palpate hard and fixed nodules, then most likely may blood stagnation po. No? May tumor, may ecchymosis or petechia, hemorrhage, and pricking pain. 27.
27. Each of the following signs may result from phlegm except pain, letter E. Si asthma, phlegm po. Coma and Braton, that's all phlegm din. Hemiplegia, ganun din. Soft and movable nodules, phlegm din po yan.
Yes.
So letter E, pain.
Okay, so nakikita nyo na ngayon bakit ang daming phlegm, yung mga ibang may hemiplegia, no? And ang nakakatawa dyan, sinusuppress sila yung phlegm. And sometimes, ina-atake yan at 3 in the morning. Daming
3 to 5
phlegm na,
kasi weak ang lungs.
yes. Okay, so now you can see, you can actually imagine kung ano yung itsura ng tongue of somebody na nagka-hemiplegia because of phlegm. No?
Swollen na ang tongue.
Tongue, very rough ang appearance, no? Ito yung matitigas ang ulo, no? Okay, 29. Okay. This time, I think you're very familiar with this.
28 pa po, Doc.
Yeah.
Number 28.
28 to 31.
Okay. Number 28. Post-menstrual lower abdominal pain, which is reduced by pressing and accompanied by a scanty reddish menstrual flow, suggests deficiency
Reduced by
of
pressing.
blood.
So this is very deficiency, no?
No, deficiency of blood. Tas scanty ang kanyang flow eh. So deficiency po talaga siya.
Very good. And number 29?
29. Excess menstrual flow, which is a deep red color and a shortened cycle, suggests heat syndrome of the excess type. excess na yung ano po, tsaka
Menstrual
ano, deep
flow.
red. So,
Deep
ano po
red,
yan,
oo.
letter A po
Okay.
yan.
30.
30, a prolonged menstrual cycle which with a scanty light-colored discharge suggests a cold syndrome of the deficiency type. Kasi cold, kaya prolonged menstrual cycle. Kabaligtaran nung ano siya heat na ano siya, shortened cycle.
Okay, and 31.
Number 31. Premenstrual distending pain in the lower abdomen, which is aggravated by pressure, and a dark purplish menstrual flow with clots suggests a stagnation of qi and blood. Distending pain, qi stagnation po eh. Tsaka dark
Excess.
purplish menstrual flow, that's ano po, stagnation of blood.
At saka compared to heat syndrome, excess heat, the color of the blood is
Red.
not deep red. Yeah, it's purplish, dark purplish.
Purplish.
At saka pinaka-importante dito may clots. Clot pa lang, stagnation na, no?
Yeah.
Yes po.
Now let's go to 32 to 34. Nagkamali po paglagay. Okay.
Okay, number 32.
Dito ako nagkamali sa numbering noong una.
Okay, number 32. Hypochondriac and lower abdominal distension and pain and a distending sensation in the breast suggest hypochondriac, a depression of the liver qi. Kasi distending sensation, distending pain, ano yan eh, parang qi, stagnation. Sa
Stagnation. Keyword dyan is distending, no?
Distending pain. So, ano yan, liver qi,
Stagnation or depression or
Depression.
Okay, number 33. Dizziness and distending sensation in the head suggests a flare-up of the liver fire.
So think
Parang
of this as
natin ito kanina,
umaapoy.
Doc, dun sa mga liver patterns kanina.
Yes. Oo. Sa ulo na eh. Hindi ka dapat kasi umabot sa ulo yung liver. Umabot na sa ulo, nagde-distend na.
Flare up na.
Yes. And number 34.
34. Dizziness and numbness of the limbs suggests a deficiency of blood in the liver. Hindi na makaabot dun sa mga extremities yung dugo. So, ano na, numb.
Okay. If there is stagnation of cold in the liver channel, so ibig sabihin, this is not actually affecting the liver organ itself, no? So you need to be able to know where the liver channel is coursing through. Okay. So mayroong cold stagnation. So probably pumasok yung cold dahil nagpapaa or
kaya pa natin.
Tama.
Yes.
O kaya exposed sa ano, sa elements, kumbaga.
And so the pain here is going to be very intense, and this can only be relieved by hot compress or warm compress. Okay. So liver channel lang yan eh, hindi pa talaga affected yung liver. Okay, very good. Okay, let's go now to, thank you very much, Ma'am Lynn, and Ma'am Teresita will take care of the rest. Okay, this is very easy actually. 35 to 37.
Pain, 35. Pain in the epigastric region, which is aggravated by cold and alleviated by warmth, suggests retention of fluid in the stomach due to cold. Letter B po. Because it aggravates by
Aggravated by cold.
Aggravated by cold. So it is retention of fluid due to cold.
Okay, number 36.
Pain in the epigastric region accompanied by foul belching suggests retention of food in the stomach. Parang review lang po ito sa last question, mga previous questions.
Mm.
Number 37. Okay na po, Doc?
Yeah.
Burning pain in the epigastrium accompanied by preference for cold drinks suggests hyperactivity of fire of the stomach.
How would you
So,
describe the appetite of the patient?
Doc,
How would you describe the appetite of the patient?
voracious appetite, Doc.
How is it
Gusto-gustong
different
kumain.
from?
Parang ang bilis ng ma-digest yung food niya.
Yes.
Because of the hyperactive
Laging
fire of the
nagugutom.
stomach.
Laging gutom.
Laging gutom. Bago pa lang kumain, gutom na rin. Naghahanap na din ng pagkain. Pero hindi naman tumataba.
Okay, 38 to 41.
38. Dry cough with scanty or no sputum accompanied by afternoon fever suggests dryness of the lung due to a deficiency of yin. Because of this dry cough with scanty or no sputum.
Tsaka afternoon fever.
And then afternoon fever. Sa yin po yan, deficiency of yin symptoms.
Okay, number 39.
A cough with excessive sputum, which becomes more severe in winter and accompanied by anorexia, suggests deficiency of yang of the spleen because it aggravates, because yang deficiency of yang cold na siya, and then so it aggravates during winter. Parang more cold na. Hindi na niya kaya kasi cold na ang ano niya, mga limbs.
Okay. And number 40.
Needling with a reinforcing method combined with moxibustion can be applied to the syndrome of deficiency of yang of the spleen and deficiency of kidney yang.
So, if you notice, magkasabwat talaga ang dalawa.
Ay, opo.
If you have kidney yang deficiency, you will also have spleen yang deficiency.
Tsaka reinforcing method po kaya deficiency patterns talaga ang kanyang
Yes, with moxa. Number 41.
Acupuncture without moxibustion is best applied to dryness of the lung due to a deficiency of yin. Kasi hit na siya, Dok eh.
Yes.
Tapos
Kulang na siya ng yin.
Opo.
Okay.
So no need of moxibustion.
Number 42. Kaya sana yung mga nagmamoksa, no, marunong mag-diagnose. Ganun pa rin.
Opo, para hindi mag-aggravate ang heat sa body.
So, I hope this was emphasized, no? You just don't do moxa all the time. You have to always look at the tongue. Do you agree?
Yes po.
So, hindi po pwedeng puro ka lang moxa. Okay.
I-identify mo na ang pattern whether it is cold or hot.
Yeah, a classic example there is pag may impotence, no? O yung mga gustong ay nakakatakot yan. Lalo na pag medyo maedad na, wala nang coating yung tongue. Then binigyan
Opo, tapos
mo ng
moxa pa.
moxa. Oh, yan ang danger dyan.
Kaya hindi tayo basta-basta.
Yes. So if you see anyone not looking at the tongue, nagmoksa ka agad, then he did not train with us, no? Okay. 42 to 45.
Watery diarrhea with abdominal pain and borborygmus suggests cold and dampness in the intestine. Because of
watery diarrhea
with abdominal pain. Tapos may borborygmus pa. So,
Very
cold. Very cold na siya and dampness in the intestine.
Okay. 36.
43.
Oh, I'm sorry. 43 pala.
Loose stool with undigested food suggests deficiency of spleen yang. Hindi kaya niyang i-digest ang food. Kasi deficient na siya.
Oo.
Malamig kasi. Kulang sa heat.
True. Number 44.
Slight abdominal pain, borborygmus, and diarrhea once or several times each morning at dawn suggests deficiency of kidney. Ulit-ulit na lang po, Doc, ano?
Yeah. Hanggang sa ano sa ulo.
Pero minsan makalimutan pa, my God.
Actually, dalawa ang answer dito.
Ah,
Bothering ano siya.
Diba? A and B.
and deficiency. Ay, tama. Deficiency of spleen yan. Tama po.
Of course, A and B.
Hindi nakita.
Diba?
Ilagay ko.
They always go together. You cannot just say
Tama.
kidney yang.
Mhm.
Oo, diba? Pag may kidney yang deficiency ka, mahina din yung spleen. Nobody ever commented on this last time.
Hindi ko rin nakita, Doc.
Diba? Do you agree, Ma'am Lynn?
Yes po.
In fact, yung abdominal pain, that's very spleen. The diarrhea is spleen. At saka ano, the intestines are dependent on the kidney yang, the small intestine. Kasi pag naririnig mo na yung concerto, no? Oh, yun. So the answer should be A and B. Diba? A and B.
Okay,
I'm
supposedly
sure maraming
A and B.
nakaka-relate niyan, no?
Yes, like me.
So these
Relate na relate
people,
si Ma'am Lynn.
Problem ko po
kailangan
talaga yung borborygmus talaga.
may nagsabi sa akin you need to wear medyas at night
Mm.
to actually conserve the heat.
Pero may nabasa din po ako, Dok, hindi daw maganda yung palagi kayo nakamidyas at night when sleeping. Para hindi daw relax yung ano, ewan ko lang. Which
Depende.
No, what I said was if you have kidney yang
Yung
deficiency,
deficiency.
hindi naman
okay, depende pala.
Malalamig ang talampakan.
yeah, tapos nagtatai ka.
Oo. Laging kumukulo-kuloan siya.
But
Oo,
actually,
naranasan ko din yan, Ma'am Lynn. Yung nag-iisa pa ako sa bahay. Halos, akala ko hindi na ako mabot ng next day. Ay, malamig talaga ang pakiramdam ko. Akala ko nag-collapse na ang yang ko.
Okay, number 45.
45. Diarrhea with yellow, hot, loose, and fetid stools suggests dampness and heat in the intestine.
So it is the combination of dampness and heat that gives the fetid.
Yellow.
Yeah,
Yellow. Hot, loose, and fetid stools.
We're almost done. Okay.
Yes po. Number 46. May cause mental restlessness and give rise to palpitation, insomnia, irritability, anxiety, and even mental disorders. So my answer is excessive joy or fear and fright.
Yeah.
Yes.
Kasi mental restless na po kasi ang mind natin do kasi hindi na house ang shen. So, and may anxiety. So, kung palagi na lang kayong may takot at may so, hindi ka makatulog. Kasi restless na. Kaya, it results in mental disorders.
Dito nyo makikita na kailangan talaga may communication between the heart and the kidney.
And the kidneys.
Diba?
Opo. Affected si heart pag mag-deficient na ang kidney niyin.
Of course.
Ang kidney.
And vice versa. Pag affected siya. Kasi kailangan ni heart ang coolness, ang water ni kidney.
Opo,
kung wala ka ng water, mayroon ka ng yin deficiency, di pupula na yung tongue.
Fire na fire si heart. Fire na fire si heart, so kailangan niya ang water ni kidney.
Yes. Diba? Pero meron ding iba, ang putla-putla ng tongue. At lalamig pa. Kulang sa fire, no?
Yeah.
So meron siyang kidney yang deficiency. Now you see the connection. So never
Mm.
forget to treat the kidney when you have those situations. And always look at the tongue. So this is where we realize that tongue diagnosis is very, very essential.
Mhm.
I don't know if everybody's taking that seriously.
Mhm.
Grabe, bugbog na bugbog tayo with pulse diagnosis, no, ni Ma'am Mildred. Pa?
Opo. Grabe, tapos
Paulit-ulit, no?
inulit na naman ngayon sa basic.
Mm-mm. So it's
Para
always there,
maintindihan talaga.
like when we give cases, you should always see, you should always have the tongue picture, di ba? Tongue and
Yeah.
pulse.
Tongue and pulse. Importante yan sa diagnosis ang tongue
Yeah, so
and
pag hindi nag-tongue and pulse,
wala, hindi lang trained.
Symptomatic ang magiging ano nun.
pasensya na ha.
Symptomatic at
Because,
approach lang daw.
yeah, and I noticed ang konti lang yung points talaga ng tongue and pulse. So I was, I was thinking, paano ka magiging magaling na diagnostician? You don't even know how to look at the tongue, right?
In
And,
fact, Doc, yung mga doctors, Doc, gumagamit sila ng pulse. Sa pulse na malaman ko, ay sabi nila, ay may init man ito sa loob na hindi nakalabas.
pero sa
Yan.
pulse kasi, inaano lang, yung tinitingnan doon, yung rate lang.
Oo.
Kasi meron namang ECG doon mo na makikita yung mga rhythmicity, yung...
Opo. Mas easy siguro ang medical doc kaysa TCM, no? Ano ba? Ikaw, Doc. alin ang more easier?
Mas marami, mas may logic kasi ang, although it may sound far-fetched sometimes, pero you just have to accept the fact na may interconnection talaga lahat ng organs. At saka, it's kailangan body, mind, and spirit talaga. Hindi pwedeng mawala yung isa. It's just like saying the jing, no, then the chi and the shen. 'Di ba? Pag mahina yung jing and chi, wala, masisiraan ka talang bait yung shen.
Holistic kasi ang approach ng TCM Parang
And
lahat ng natin.
yeah, not
Lahat
everybody.
Hindi siya parang pinaghiwa-hiwalay na parts.
Hindi.
Kasi
Kaya,
sa Western medicine ngayon marami ng mga mga
Kasi sa specialized siya. So,
parang hindi na talaga mag-isip ang mga medical doctors. Depende na lang sila sa mga equipment.
Saka magka-contra po minsan yung magka-contra ang treatment. May mga cases na ganun.
Opo.
sa kasi they don't consider that every individual is unique. 'Di ba? Parang kaya pala hindi gumagaling yung iba gumagaling kasi hindi siya hiyang doon. So, in fact, in Chinese medicine, you may have 10 different patients with different health issues, pero iisa lang yung approach dyan.
The same ang pathology.
Yeah, when you have 10 diabetic patients, hindi din pare-pareho yung approach niya.
Yeah.
So it takes time. And without the basics, hindi mo talaga magigets.
Opo, mahirap, Doc?
Ay, mahirap. Mahirap. Yeah, mahirap talaga.
Mahirap talaga.
Kaya palaganapin na natin.
Tsaga-tsaga lang.
Kasi parang headache yun. Pagka sa Western Med, isa lang yun paracetamol. Pag sa atin, iba-iba.
Iba-iba.
Minsan, memorize lang ng doktor.
Depende kung nasa anong bahagi ng
sige.
Kaya dapat
sa atin, marami pa tayong mga examinations.
Totoo. Kailangan pa talaga magpatingin talaga ng tongue, magpa-feel ng pulse, no?
Palpate ng channels.
Yeah. So let's go to 48.
47 pa, Doc.
47.
May cause dysfunction of the liver and its ability to promote understrength and patency of vital energy. This in turn will give rise to pain, and distension in the costal and hypochondriac region, mental depression, and irascibility.
Okay, so
My answer is excessive anger.
yes. And excessive anger, there is always depression.
Yes po, dysfunction of the liver talaga siya, Doc.
So
Liver.
when you talk about bipolar disorders, primarily it's the liver, right?
Yes po. Liver na liver kas talaga ang bipolar.
Yung mga suppressed anger, yung mga kinimkim. Okay, number
Kinagalit. Pag hindi na makimkim, it will burst out.
precisely. Number 48.
May cause dysfunction of the spleen and stomach in dysfunction of the transformation and transportation and cause anorexia and abdominal fullness and distension after meals. My answer is excessive grief, melancholy, and meditation because this is the emotion of the spleen.
Yes.
Grief, the spleen. Dysfunction.
Okay, thank you very much. Let's go to the last one.
49.
49.
49. A patient with a red complexion suggests existence of heat. Automatic na, Doc. Existence of heat, so there is red complexion. Okay, number 50. A patient with a bluish-purple complexion suggests stagnation of blood or severe pain because of the bluish-purple complexion. It may either there is pain or
Yeah. And the last one, patient with?
a patient with a pale complexion suggests existence of cold or deficiency of blood. So, because of pale complexion, Doc.
Yes. Okay. Thank you very much for joining.
Thank you, Lord, for
Dami natin nag
the gift of
Pero
knowledge.
kahit dalaw, yeah. And we would
Mas
like
maganda
to see,
pala pag kuan lang, konti lang, Doc.
yes, okay.
Mas mag-grasp ang explanation.
True.